What's up guys, I'm Dr. Tim Padlock. I'm here inside of Cuyahoga Falls CrossFit. I'm a physical therapist. I'm the owner of Physio, Orthopedics, and Performance. This is DPTRX. Today we are covering femoral acetabular impingement, aka hip pain, anterior hip pain in the front. Very common in cyclists, very common in the bottom of a squat, back squat, thrusters, overhead squat, anything, a repetitive squat technique. A lot of times we'll have pain at the very bottom of that. It's a pinching pain either in one or both hips. And a lot of times why that is because where your femur sits in your hip socket, your acetabulum, as it rolls anterior to flex, it'll pinch at the top because you don't have the capsule mobility that you should have in order to perform that movement. But before we jump into that, we've got to cover two different things. Number one and number two. Number one is to determine the diagnosis, so making sure that this is an impingement and not something like a hip flexor strain or some sort of problem like that, where you're actually dealing with the iliopsoas in that same area, and a lot of times very easily confused among some people. So we're looking to determine the diagnosis. Then we're looking at number two, preventing further impingement through a technique you use to find the optimal position that you should be squatting at, the optimal foot position, the optimal external angle that you should be performing your squats at. 3 and 4 will be covered in the next episode, that is addressing soft tissue mobility and joint capsule mobility. So number one, getting to determine the diagnosis. I want to decide first, is this impingement or is this a hip flexor problem? Because that's going to be completely different treatment techniques. So what you would do, you would go, and I'll just use this for example, go up to a wall. I'm having left hip pain, I'll put my knee into it, so I'm still in neutral, I'm still flat here, but you're going to press as hard as you can. So the goal is, if this wall wasn't there, to be going into this motion. And as you press as hard as you can, if you have a hip flexor strain, then you're going to have pain. If you're having pain in neutral, pressing into a wall, you're activating that muscle and that'll bring on that pain. So that's not impingement, that's actually a hip flexor problem, which will be addressed completely differently in the second episode of this. If you do have the FAI, how you would know is that it's only at the bottom of the squat, so I don't have pain in neutral, but when I get down low, this is where I have pain, when my femurs are in this flex position, or when I'm sitting like this on a bike or something and pressing back and coming up. Preventing further impingement, this is a technique that's off of Functional Movement Systems. Greg Cook, it's excellent, you guys should check it out, but it's called the pop and rock. And so basically you assume a neutral stance, a stance as wide as your shoulders. You squeeze your glutes, so you activate those glute muscles. You rock back on your heels. When you rock back on your heels, you'll probably feel your body either want to stay neutral at the hips, or like when I do it, squeeze my glutes, rock back, I want to externally rotate, and so my feet naturally point out. And so that's based on the idea that every single person has a different alpha angle, or a different angle where your hip is sitting in that hip joint, in that socket. And depending upon your alpha angle, you should have some degree of external range of motion to allow for clearance at the bottom of your squat. So the lock, squeeze the glutes, the rock, find neutral. You should be setting up with some sort of external rotation if your body needs it, if your alpha angle turns it every single time. So, number one, number two out of the way, 3 and 4 in the next episode. Again, I'm Dr. Tim Padlock. I'm the owner of Physio, Orthopedics, and Performance here inside of Cuyahoga Falls CrossFit. You got to check us out online at physioorthoperform.com. Again, that's physio, PHYSIO, orthoperform.com. Any of your rehab needs. We do a lot of wellness stuff. We do the functional movement screening. We do manual type therapy techniques, including dry needling, myofascial decompression, joint mobilization, manipulation, and deep tissue stuff with tools. So check us out for your rehab needs. Stay healthy, and we'll see you soon.